So I'm going to give a state of the school. I'm going to go through, I only have about 30 minutes, so I'm going to go through a lot of the slides quickly, but the presentation will be online on my webpage, and it's also streaming, so I assume there are a couple of thousand of our faculty that are watching right now. So as has been mentioned, we've been around for a long time, particularly the hospital. And the hospital was founded in 1852, and there were many fundamental discoveries that occurred before the medical school was founded. This was a legendary hospital which made fundamental discoveries that in its time changed the foundation of medicine. And if you go on the 5th floor in the Annenberg building, we have a history wall, and it's really phenomenal. And if you have time, you should go there and take a look at the history of our hospital and our medical school to see all the fundamental discoveries. As Peter mentioned, the school started in a garage, and thank you to Barbara Niss for providing all this history. It opened its medical school in an old bus garage, so it wasn't a terrific beginning, but there must have been a lot of confidence that this school was going to do well. And as you know, ultimately we've become great. We should also thank the Annenbergs, who gave $8 million to the medical school, and we built the Annenberg building in roughly 1973, which at the time I'm told was the largest medical school, biomedical research facility, if not in the United States, in the world. And as many of you know, we've been renovating floor by floor, so it's still a great building with great views. It's not a beautiful building, when you look at it from where Peter lives and so forth, it's not beautiful, but the views from inside are great. So we started the school. I don't know how many of you recognize this guy. That's Ken, who was in the 2nd class, and that's Ken's wife, Bonnie. And I don't know if they knew back in the class of 1973, what accomplishments they were going to make. But it's been a legendary story in terms of what Ken has accomplished as a scientist and what he's accomplished for Mount Sinai. And Bonnie, as you know, is a terrific scientist in her own right, and along with Ken, made fundamental discoveries that basically led to the class of Alzheimer's drugs that are still being used. And since the formation of the school, a lot of fundamental discoveries had been made. A lot of this is on our history wall. I'm not going to go through this. But we are known as a school and a hospital whose mission is to make discoveries that change the lives of our patients. And I say to the faculty, I say to the students, that if we're not going to make those fundamental discoveries, who's going to do it? It's really our responsibility to conduct that kind of science. And we are reaching new heights. There's a number of articles coming out in Scientific American about some of the discoveries that are currently being made by our faculty. And these are some of the numbers that deans like, especially when they're good. So for example, and Peter mentioned some of this, we are among the top schools every year in research dollars per PI, which means our individual faculty are among the best in the country. Our NIH funding is at its highest. We closed the fiscal year, September 30th, and as of now, we're number 12th in the country. About 10 years ago, we were like 25, 26. So we have risen as fast as any other medical school in the country. And as you know, competing for NIH dollars is tough, and we've been doing a very good job there. And we stand for innovation. I'm not going to mention this again. Peter mentioned some of these accomplishments regarding innovation. We're continuing to grow. We've made a lot of new appointments in the past year, including several new deans, Kumar Chitani, who leads our information technology programs for the health system, Eric Schatt, who's taken on a new role as Dean for Precision Medicine. We've added a number of department chairs and institute directors and executive vice presidents in our health system and so on and so forth. So we're continuing to grow. We've named a number of new senior associate deans that represent new initiatives in our school, including Judy Cho in precision medicine, Joe Finkelstein, who we recently recruited from Columbia to be Chief Research Informatics Officer. This is a very important recruit for us because of our commitment to big data. Another appointment I just want to highlight, and that's Jonathan Ripp. And as you know, issues related to burnout, depression, anxiety among medical students, house staff, and faculty is a national problem. And Mount Sinai is making commitment among very few medical schools to attack this problem. And so I've named Jonathan Ripp to be a Senior Associate Dean for Well-Being and Resilience, and he has now put together a team of Associate Deans to help with this problem. The class that we admitted this year is spectacular. I like to joke, and I think our faculty say this too, that we probably wouldn't get into Mount Sinai when we graduated from college. If you look at these metrics, the mean GPA is 3.84. So all these numbers are unbelievable. But on top of that, and I can't go through this now, but if you're interested, take a look at my white coat speech that I gave a couple of weeks ago, which describes the other accomplishments of our class. MD, PhD students recruited by Margaret Barron are also incredibly talented and already have done a lot of research themselves. We also admit students early. We call this the FlexMed program. This allows students who are in the middle of their college career to be admitted to medical school, to be guaranteed to come to Mount Sinai. They don't have to take the MCAT. They have a lot of freedom during the rest of their college career to pursue their passions, and then they come to us. They're also an incredibly talented group of students. A lot of innovation going on in med ed, including collaborations that we have established with the Department of the Navy, Deloitte Consultants, McKinsey and Company. So David Muller and his team are always looking to recruit a class of students that represent the spectrum of talents in America, whether they are major in humanities or hard science, or even already have experience in the military. For example, in the class that we just admitted, one student was a combat medic in Iraq for several years and had very difficult experiences in trying to save lives. Another student recently was commissioned as a second lieutenant in the United States Air Force. So you'll be very proud in meeting the current class of medical students. Very committed to diversity. We got a number of different programs that we have established to attack issues related to racism and bias. And I should point out the importance of the work that Gary Butts and his team are doing in that regard. We do have an LCME accreditation process that has started this year. We're going to be visited by the LCME, which is the accrediting body for medical schools in the United States. So we have a lot of work that is ongoing this year to get ready for that accreditation. We continue to renovate a number of areas on our campus. We are renovating Aaron Hall on the first floor to create a Center for Learning and Development. It's going to be a spectacular facility that is going to start in a couple of months, and it'll be completed in the first quarter of 2019. In terms of graduate medical education, under Marta Filisola's leadership and Mike Lightman's leadership in terms of the residency programs, we are doing very well. We have the largest residency program. There's Mike over there. Maybe just stand up for a sec. Thank you for all that you do. We have the largest residency program in the United States. So Mike has a big job. A lot of our programs are ranked very highly among other residency programs in the United States. This is an area where I think the numbers don't represent how good we actually are. So Mike and I have been, working with the chairs and program directors of the different departments about how this ranking occurs. What is the methodology? And I expect these numbers to improve in the next several years. A number of our faculty have been recipients of a very prestigious teaching award called the Parker Palmer Courage to Teach Award. Adam Levine in anesthesiology and Vicky Shanker in neurology have already received this award, and this year Sadia Akhtar received the most recent award, which reflects our commitment to teaching our residents. In terms of our PhD students, and this is under the leadership of Marta Filizzola, the quality of our PhD students has improved dramatically over the last 3 or 4 years under Marta's leadership. This year we enrolled a class of 41 PhD students, 22% who come from underrepresented in medicine and science, and you can see the academic quality of those students. Our master's program has been growing, and both in size and in quality of our students in all the areas that you see on this slide. A number of accomplishments that I'm not going to go over in detail. I want to mention that we are launching a biomedical data science initiative, which is consistent with the overall initiative at our school in committing to be one of the best places in the country, if not the world, as it relates to genomic scientists, science, and data science. We have an Office of Academic Development and Enrichment. This is led by Lakshmi Devi and Liz Howell. It reflects all the work that they're doing, reflects our commitment to mentorship. We want to be the place where students and other trainees, postdocs, and house staff come, where they know they're going to get high-level mentorship and a roadmap to be successful in their career. And refer you to these slides that reflect all the work that our team has been doing as it relates to promoting academic development and enrichment. As I mentioned, we have a major commitment to diversity in all its aspects. We're working very hard to reduce issues related to unconscious bias. And this work is, again, led by Gary Butts and also by David Muller. And one reflection of how well we've been doing so far, although we have a lot of work to do, is that we were ranked #1 by Diversity, Inc. In 2018, which is the 4th consecutive year that we are ranked among the very best in the country. I want to note that our Office of Diversity and Inclusion just marked the Patricia Levinson CMCA program marked its 20th anniversary this year. A new initiative that we established this year with Jonathan Ripp as the Senior Associate Dean is an Office of Wellbeing and Resilience. And John has begun to initiate a number of different programs that will come to fruition over the next year. He's put together a team of associate deans covering our medical students, our graduate students, our house staff, and our faculty. We're promoting well-being and resilience through a number of different programs. One of the first things we're going to do this year is conduct a survey of those groups to determine, what do we need to do better to enhance well-being and resilience. So I mentioned our NIH funding. This is how we've done over the last several years. As I mentioned, we're number 12 overall. And a number of our basic science departments are in the top 5. And a number of our clinical departments are either in the top 10 or just above it. We've developed a strategic plan with Eric Nestler's leadership that we are now embarking on. And so I expect our NIH funding to continue to improve over the next several years. Particularly, we want to enhance the clinical research that we're conducting in our departments. As Peter mentioned, and Ken also alludes to, that it's important that our science result in new treatments for our patients. That it's not enough to say this over and over again just to get grants and to publish in top journals. Not enough. We need to discover new treatments, and if we don't do it, there are very few places that can do it. And so as part of not only investing in our faculty, we've also invested heavily in Mount Sinai Innovation Partners, which is our tech transfer office. We have over 30 staff in that program. It's led terrifically by Eric Liam. We've got a lot of new programs that help our faculty, including an accelerated program which involves startup support for research that has the potential for commercialization. And that's resulted in new groups, new innovation groups. And we've spun out more companies this year than ever before. We've got a lot of new licenses with pharmaceutical companies and other startup companies, which has the potential to lead to a lot of very exciting new treatments for our patients. I want to say a word about our faculty practice, and I want to acknowledge the leadership of Bert Dreyer, who's the CEO of our faculty practice. I think we have the largest faculty practice in the country, so it's a big job. Our clinical faculty have done an outstanding job this year in growing our faculty practice. We do have more work to do in continuing to grow it, but this year we've done very well in terms of the growth, which is 7.8% when we adjust for spinning out the Semaphore. We've got a good operating margin. So this work has been very helpful to the health of our school. And we have a lot of new initiatives going on over the coming year relating to our central billing office, new sites for our practices, with a particular emphasis on developing multi-specialty, multidisciplinary practices so that it can be one-stop shopping. If you go see your primary care doctor and you need to see a specialist, we're going to make it as user-friendly as any place in New York City. As Ken emphasizes often, that access is critical for our patients. That if you have a problem and you need to be seen the same day, we're going to make sure that you are seen the same day. And so we're putting a lot of effort into those initiatives. Our Access Center has grown dramatically. Just as one example, and this to me is an unbelievable number, look at the number of calls per year that are coming into our Access Center. It's gone from 2 million to 4.2 million projected in 2019. And Bert and Brian Smith and the leadership team, Alan Nadler, have working very hard to manage this growth to make sure that it works for our patients and our clinicians. A lot of ongoing initiatives, which I'm not going to go into, but we're looking to expand and at the same time show a commitment to the patient experience. And we have a new initiative called Commitment to Caring, which is working with our staff, our physicians, our front office people to make sure that the patient comes first and that the patient experience is unequaled. And this shows some examples of the growth of our faculty practice. And this is in thousands, so that's 1.8 million ambulatory encounters in 2018. Finances. You could have a lot of great ideas, but if you're not financially disciplined, it's not going to work. And I want to thank Steve Harvey, who is our Chief Financial Officer. When Steve walks down the hall and goes into a department, he's not always greeted with applause. But the discipline of being financially disciplined is very important to the health of our school, whether it's how we allocate space, who we recruit, the productivity of our doctors. It's all extremely important so that at the end, we're doing well financially. So that when we have a capital campaign, which we have initiated with Mark Costigan's leadership, and we get philanthropy, that philanthropy is used, for new programs, for new initiatives, and not to cover deficits where it won't be as useful. So this is how we've done over the last few years. It looks like so far, although we have a couple of months to go, that 2018 will be a good year. If you break even as a medical school, that's actually a good number. And this are some of the issues that relate to how well we can do financially. Research is very important. As I showed you, that the number of dollars we're getting from NIH is a bit much bigger than ever before, certainly very, very much bigger than a few years ago. We have a backlog of unexpended grants that exceeds $350 million. Now, you may say, well, that's great. Well, in some respects, it's great. It means we have a lot of cash in the bank, but it's actually not so great if it's so large, because it means if you're not spending your money, and I'm talking to our faculty out there, if you're not spending your research money, we don't get the indirects. And so the money just sits there, and you're not hiring staff. So it's very important that you spend your grant money, and we'll be talking to you over the next several months to bring this bring this number down. I mentioned the importance of discovery and licensing our science, and we've got a lot of good things that are happening over this year and over the coming year. We're getting royalty income based on a discovery by Stu Sealfond, Elagalix, which we expect to start coming in 18 and further in 19. I'm personally very hopeful about the discovery that my team made, that ketamine is a rapidly acting antidepressant. That has been submitted to the FDA for approval a couple weeks ago, and we're hopeful that will then hit the market in 2019. We're spinning out companies that have a lot of growth potential, and so on and so forth. There are challenges to our continued growth. It's important that the faculty practice continue to do well and even better if possible. We have clinical space constraints that we're working on. We need to continue to grow our royalty and licensing income, and the capital campaign is also very important to our growth going forward. I'm not going to go through this in detail. You'll see this on the website, but we have an action plan that the faculty needs to be very much involved in to continue to meet our financial challenges. We developed a strategic plan in 2017. We're now implementing that plan in 2018. The guiding principles are to take advantage of the size and excellence of our health system, to have unrivaled excellence in our medical and graduate education, to anticipate new areas of research. That's not easy, but we've been good at that so far. To not only invest in what is obvious, but to invest in what's going to be important over the next several years, and essentially to power an engine of discovery. So these are some of the things that we have started to do. We've established new research institutes, including the Addiction Institute, the Adolescent Health Research Institute we're working on, the Exposome Institute under the leadership of Bob Wright, Institute for Transformative Clinical Trials under the leadership of Annatine Galians, and the Women's Health Research Institute under the leadership of Liz Howell. We're going to expand our research in those areas and these areas. We established a new academic department on health system design and global health, the only such department in the United States. And under Joel Dudley's leadership, we're making a lot of progress on next generation health care, including Lab 100, which many of you have visited. We're going to invest further in medical education and be innovative in that space, and in graduate education. And as I mentioned, we're going to fund new areas of research, particularly in precision medicine, which reflects the leadership that Eric Schadt will provide as Dean for Precision Medicine, and the leadership that Adam Margolin and Judy Cho and others will provide in their roles in the school. Precision medicine affects all areas of medicine, and it's going to have a more important role as time goes by. Cancer, heart disease, brain disorders, and childhood illnesses, and so forth. So we see that as a fundamental area for us to invest in going forward, and it involves drug discovery and genomics and predictive analytics and so forth. We're going to establish, and we're just working on this, a Center for Genomic Health. Emphasis health, and to use emerging advances which have resulted in a reduction in the cost of having your genome sequenced, and new innovations on how to provide reports back to the doctor and the patient so that a genomic screen can be part of your health care in a routine way, just like getting a CBC, so that you go to your primary care doctor. And one of the things you ultimately get, and we want to be a leader in this because it's not happening yet, that we say, you know, I think we ought to do a whole genome sequence and determine what genes are actionable right now that you may not know about, and what genes do you have that might place you at risk for diseases later in your life, whether it's heart disease or cancer or mental illness or metabolism of drug problems and so on. So we haven't established this yet, but we're going to over the next year, which will involve collaboration with the Bronfman Institute for Personalized Medicine, the Institute for Next Generation Healthcare, our Department of Genetics, our Institute for Genomics and Multiscale Biology. We're going to bring all our leaders in this area together to form this new center. We're going to invest in immunology going forward, and as I mentioned, further investment in drug discovery. As part of our strategic plan, we're going to have to recruit more faculty. So as Mark raises all this the money, we will be hiring new faculty, consistent with what we did before in our strategic plan that was so successful back in 2006 and 2007. We are going to need new space, and this is going to be a process. Our first initiative will be to renovate 3101st Street. That's a building that some of us have called the nurses' residence, although hardly any nurses live there anymore. That's right across from our emergency room. We own the building. We're going to renovate it to create a center for data science and technology, which will facilitate what I've already mentioned, like a center for genomic health and predictive analytics and so forth. So that'll be our first project. And then down the line, we're looking to build another major research building, a life science center, which will allow further enhancement and growth of our cancer programs, our clinical cancer programs, which have grown tremendously over the last several years, discovery science in wet lab space, and incubator space for the formation of new Mount Sinai companies and perhaps other companies as well. And just to highlight again, the ultimate outcomes that we're going to hold ourselves to as a faculty and a training site: outstanding publications, more NIH funding, more intellectual property, collaboration with industry, more Sinai companies. But most important, and we can't say this enough, discovery that changed the lives of our patients. I want to thank Rama Iyengar for, as usual, he's done this with me for the last 12 years, for putting together this presentation. I guess Mark wanted me to have this in here. So here's our goal. Initial goal is 1.5, but we're pushing to go to 2 billion. We're in that phase now where we're talking to potential donors. So far, so good. I want to remind everybody of our conference, which has been so successful, coming up in a couple weeks, Sinai Innovation Conference. And I want to thank Terry Krulich, who has just retired, who is a legend at Mount Sinai, an outstanding scientist, educator, humanist, leader, first incumbent of the Klingenstein and Case Professorship, which we're awarding again tonight. Terry joined Mount Sinai in 1970, outstanding scientist, continuously supported by NIH for over 40 years. You know how hard that is? There's probably a few people in the history of NIH that have been supported for 40 years. The work has had a major impact, as noted here. In terms of what Terry has done for Mount Sinai, Dean of the grad school from 1981 to 2002. One of the first women in the United States in this role. She has been a role model for women in science before it became, I shouldn't say important, but before it became a major initiative that it is today at Mount Sinai and around the world. She was also director of our PrEP program, in which we have funding from 2001 to give recent URM graduates research experience prior to careers in science, technology, engineering, and mathematics. Over 100 students have participated in this program, with the majority now in successful careers. At this point, I'd like to ask Terry to stand, and let's acknowledge a legendary leader of science and medicine at Mount Sinai and around the world. Thank you, Terry. We can't thank you enough for what you've done for us. And we have lost a couple of people this year that I want to acknowledge in terms of their remembrance. Pamela Sklar, outstanding psychiatrist, neuroscientist, geneticist, role model for women in science, gone too soon. Ihor Lemishka, who led our Stem Cell Institute. He loved science, was a great scientist, made fundamental discoveries related to stem cell. Gone too soon. And James Holland, a physician who helped show that chemotherapy could treat cancer, winner of the Lasker Award. His work literally helped save the lives of millions of people. We lost 3 great people this year. Let's have a moment of silence in their memory. Thank you.